Dr. Kanaya, thank you so very much for joining us for the Trailblazers in Health series.
Thank you.
It's a pleasure to interact with you. Talk about your interest in the cardiovascular disease and also about your research in the South Asian Americans.
So my interest probably stemmed both from what I was seeing in my family in terms of early onset of diabetes and heart disease in my immediate and extended family, and also what I saw when I take care of patients in the clinic. I'm a primary care doctor and internist, and I noticed that a lot of my patients who were South Asian were really having a very difficult time both controlling their diabetes and getting a lot of bad complications from their diabetes.
Given the present situation, the scenario that we all are in, some are aware, some are vigilant, but many of us are not well aware how they should be taking care of their health in case they have the underlying health situation, specifically, a health condition. They've been through a heart attack or a cardiac arrest. What would be the advice?
Yeah, no, I think the number one thing is to have a regular relationship with your primary care doctor. And that means at least once a year, more often if you have chronic diseases like diabetes, high blood pressure, or heart disease. You need to be seen just like you take your car in for a tune-up. You get an oil change every so often. Think about your body and how much you need to, invest in regular care of your body, making sure that you're seeing your physician and you're getting your risk factors measured and managed.
Can you also talk about the importance of conferences such as, the SKN conference that was organized, the kind of awareness that it creates and the alliances that they should develop with the other South Asian organizations to raise awareness?
Yeah, I think it's going to take many different sectors working together, and that's what I liked about this conference is it wasn't all just scientists working on cardiovascular disease. It included patients, it included clinicians and other types of healthcare providers, and it included a broader, scientific community from all around the world. And this is what it's going to take to really work together across many different sectors to move the needle here. Things are getting slowly worse, actually, in South Asian health in the United States, and even worse in the South Asian subcontinent. And we really need action now. And the only way to really make meaningful and lasting change is to work together.
As an internist, I'm sure you're interacting with a lot of patients who have the, cardiovascular health issues. In your opinion, what are some of the key reasons that we are not able to handle or, we are not able to control or manage the cardiovascular disease optimally in the South Asians?
Yeah, no, I think it's multifactorial. There are many reasons that we're not doing a great job. I think a lot of people believe that if they changed their lifestyle with diet and exercise, that everything would get better, and they're hesitant to start medications because many of these medications are for the rest of your life. And there is a little bit of hesitancy when people think, oh my God, now I have to take a cholesterol medication and a blood pressure medication and a diabetes pill and maybe 2 more pills to help control these risk factors. So there's some hesitancy thinking that I can do better. I can do better with my diet and that's all it'll take. But unfortunately, the way things are moving and as people age, oftentimes just lifestyle change is not enough, and we have to work together with lifestyle and other medication therapies and sometimes interventions to really improve health.
Keeping the environmental factors in perspective, what would you say about the South Asian immigrants, versus the natives? I'm talking about the health conditions of theirs. You see, vis-a-vis, if they were staying in India, what could have been different than what it's happening with them when they're living in United States of America?
Yeah. So our study, we've been doing the MASALA study for the last 10 years. So we have 98% of the people in our study are immigrants. So they immigrated here anytime from the 1960s to just recently. So a range of immigration histories. And what we find is that the risk factors are quite high in these immigrants to the United States. We've actually compared immigrants in the US in our study to people living in India now. Same age group, looking at people who live in Chennai and live in Delhi, so urban areas of India. And some things are a little better here in the United States, but some things are a little worse here. So what we did find was better is that the immigrants in MASALA had slightly lower rates of diabetes compared to the people living in India now. This is new and interesting and scary because other prior studies that have been done in the 70s, 80s, 90s looked at people who immigrated to the United Kingdom and India, and they found the rates were much higher in the United Kingdom and much lower in India. The fact that they're reversed now with immigrants in the US having lower rates than India just tells you that this is, it's an explosion of what's happening with diabetes in the subcontinent itself. Some rates that we're doing a little bit worse here is that there's more obesity here in the South Asians who have immigrated. There's higher cholesterol levels here. There's higher rates of high blood pressure and more kidney disease here. So not doing better across the board in the immigrants, but at least the diabetes is a little bit better.
I love the name Masala Studies, and let me bring in some masala up over here and understand the relevance of spices in our day-to-day life and how significant role can they play in having a healthy lifestyle over here.
Yeah, definitely. I mean, this is traditional ancient wisdom, right? I mean, there's some really good spices that are in our culture, like turmeric, haldi. Very anti-inflammatory, antioxidant, is wonderful. And now the West has adopted haldi into honey chai and honey teas and stuff. And it's beneficial in many ways for lots of inflammatory conditions. Garlic, ginger in the same way can be also considered to be healthy. And so there are really healthy things in our diet, but there are also some things that are a little bit less healthy. The way we cook foods, we tend to use a lot of oil, and the oil is often reused, and reusing oil makes it less healthy. And so this is a few things that we can do to change the way we are cooking our culturally favorite foods to make it somewhat healthier.
Now, while interacting with the other medical professionals at the conference and in general through your masala studies as well, the research that you folks are doing, can you talk about some of the advancements in the area of medicine, if we more precisely put cardiovascular disease at the forefront? What does the future look like?
I think the future looks really bright, and I am very optimistic because I am a strong believer that we can modify and manage many of our risk factors. Yes, it may take more than lifestyle. It may take medications or other interventions to get there, but I believe that our risks of dying from heart disease are way lower than they used to be, but our smoking rates are lower. We can manage our diabetes better. There's some amazing new medications that have low side effects and also are great for preventing heart disease. There's really great blood pressure medications available, and there's really great cholesterol lowering medications available. All of these are working together in bringing down the overall rates of heart disease around the world. And these are things that people in the US and in India and everywhere can have access to. And it's a question of equitable access, getting these types of medications affordable into everybody's hands.
So I'll wrap up the conversation with two more questions. The second last, of course, I want to understand that during your masala studies, the research that you folks have been doing, any particular case study that came across that was an eye-opener for you folks that you think would be very, very relevant and many from the South Asian community would resonate with? Can you talk about that?
We don't do case studies because we have 1,160 people who've been in the study now for 10 years, and we follow them as a population in the study. I can tell you that a majority of people in the study are now more and more aware of their risk factors, and I don't know if that's why they're in the study, is they're interested in their risk factors, but I think overall what we're seeing is that people are getting a little bit more interested in health. They're getting more interested in wanting to know, what things can I do to help improve my health. And so this is what makes me very optimistic about the future.
And lastly, your final remarks for the South Asians, watching this interview all over.
Yeah, again, I think, yes, we may have been, somehow at more risk. Maybe our genetics have put us at slightly higher risk of developing heart disease, and maybe some of the things we've been doing with our diet and lack of exercise and stress levels, and these have accelerated our disease risk. But I think there's so much more that we can do about it now that I think it's empowering, and it's really important for you to become informed and know your risk factors and manage them. And often that takes a team and a community working together. Get your primary care physician involved and start working together with your family to really improve everybody's health in your life.
So I think what's significant over here is to stay informed and stay empowered. Dr. Kanaya, thank you so very much for joining us for this session. It was wonderful to interact with you.
Thank you.